Lab 6 marks the start of our skeletal unit with the skull. So at this point we've moved on beyond histology and we're going to start looking at some bony landmarks. Now the skull is one of the trickiest skeletal labs for students because there are just a ton of things going on here. And we're going to talk about cranial bones, we'll talk about facial bones, and then we'll talk about all of these landmarks that we can see from different views of the skull. So this one's going to take time. It's going to take repetition in looking at the skull from many different views to master the material. So first off, we're going to talk about the 22 bones that we see in the adult skull. We do have a fetal skull, but that will not be on your test. So we're going to ask you questions basically from this view. I can manipulate this skull every which way, and we also have our cranial vault. So to start, we have 8 cranial bones and 14 facial bones. Most of them are going to be paired with just a couple exceptions. So if we start, I'm actually going to start by talking about the sutures that divide our cranial bones. So normally your skull will look like this. So if we line it up, you can see we've got these jagged sutures running down the skull. So the main ones that you need to know are the coronal suture. That one runs across the crown of the head. So let's manipulate this here, make sure it's lined up. Crown of the head is going to be this view. So sometimes this is referred to as the coronal section through a coronal plane. We have the sagittal suture, which is running posterior to anterior. And you can see this one does continue down to separate what technically is 2 paired frontal bones, but normally this area is going to be fused in adults. If we turn this to the side now, we can see the squamous suture. That's going to be this guy here, separating the parietal and the temporal bones. And then from a posterior view, we can see this kind of upside Y-shaped suture. So this is going to be our lambdoid suture, and it's going to separate the 2 parietal bones from our occipital bone, which is the most inferior. Okay, so to review, let's talk about all of the cranial bones. We've talked about occipital posteriorly, most inferior down here. Frontal, like the name suggests, it's going to be the front bone, so to speak. So frontal, it's going to be this big guy. So in this skull, it does look like it's separated by that sagittal suture, but imagine this is fused together, and that's what we would expect to see in an adult skull. Laterally, we have our parietal bones. So this is a pretty big one. It is paired. So you can follow the coronal suture and the squamous suture to figure out the bounds of this parietal bone. We have temporal bone, which is going to be everything inferior to that squamous suture. And we'll see this from a couple different views. We'll also flip the skull over and look at some of those bony landmarks from an inferior view. And then we have the ethmoid and the sphenoid bones. So these are a little deeper, meaning you can't really see them from this outside perspective. We can see a little bit of the sphenoid bone through the orbit, so it's going to be forming most of our orbit. But really the best view to see the sphenoid is going to be if we crack open that cranial vault and look at an interior view. So from this interior view, we divide it into cranial fossa. The anterior most is also going to be the most superior. So if we turn this slightly, you can see we've got kind of 3 different levels. So think of this as your ground floor, second floor, and third floor. So the anterior cranial fossa is going to be this 3rd floor. The middle portion is our middle cranial fossa. That one is pretty easy to make sense of. And then this most inferior base ground level area is going to be the posterior cranial fossa. So the sphenoid bone is going to be that boundary between the anterior and the middle cranial fossa. And when you look at a view like this, it's not nicely divided. This is not color coded. Everything kind of runs together. So when we look at this view, we'll focus more on the landmarks that we can see in here rather than identifying specific bones such as the sphenoid. And we have one more bone in the cranial family, and this is going to be the ethmoid bone. This is another tricky one to see. So we actually see a bit of it poking up here, but the ethmoid bone is going to be really deep. So we can get to it a couple different ways. We can go through the nasal cavity and see parts of it, like the perpendicular plate here. If we go further back, we'll see the nasal conchae. It's a little harder to see here, but this is one of those deep bones. So I'm less likely to ask you to identify the bone on the lab exam, and I'm more likely to ask you to identify bony landmarks. So in the next video, we're going to get more into those bony landmarks. But first, let's quickly go over the facial bones. So from an anterior perspective, we have mostly paired facial bones with a couple exceptions. So let's start, let me grab my mandible here. So this is more like what we'd see in a complete skull. So it's not going to stay perfectly for us, but I'll take that away soon. So down here we have our mandible, what is commonly known as our jawbone. We'll talk about some of the bony landmarks we'll see there. Forming the other half of our jaw, so to speak, is going to be the maxilla. So we normally associate the maxilla with the teeth, but it's also going to have some bony landmarks that we'll talk about when we get to the orbit. So those, we technically have two maxilla. So there used to be a suture that closed during development, but what we have here is two paired maxilla versus one mandible. Okay. We have the femur, so it's going to be this little slip of bone here. It is best seen from a lateral perspective, so we'll look at kind of a mid-sagittal section of the skull and talk about the femur a little more. But it's basically a wedge-shaped bone. It's going to go really deep into the nasal cavity. We'll talk about a little more about the nasal septum as well and the bones that make up that. So after femur, we have the nasal bones, which form the shape of our nose. So two nasal bones here. This plus cartilage is what gives us the outline of our nose. Next to the nose, we kind of have three different levels here. So it's going to go nasal bone here, and then we have the lacrimal bone. So we don't have a really nice definition here, but we expect the lacrimal bone to be approximately this area. Next up, we have the inferior nasal conchae. So these are pretty special because we actually have three sets of nasal conchae: inferior, middle, and superior. The inferior nasal conchae are the only ones that make up a distinct facial bone. So the other two will be extensions of the ethmoid bone. So we can, if we look through here, we can see the inferior nasal conchae. It is a paired bone, so we'll have them on each side. And then you can see higher up and a little deeper, we're going to have, maybe if I flip this around, we're going to have our superior and middle nasal conchae. You can see them through there a little bit. These help swirl air around, so they act like turbines to moisten the air and warm it up before it reaches our respiratory tract. Next up, we have the zygomatic bone. Think of this as our cheekbone. So basically the arch of our cheekbone, called the zygomatic arch, is going to be formed by the zygomatic bone and then a little piece off of the temporal bone. So it gets a little confusing, but the temporal process of the zygomatic bone is going to combine with the zygomatic process of the temporal bone to form this zygomatic arch. So don't get those mixed up. Next up, we have the palatine bones, and these are going to be that last paired bone of the facial. So I want to talk a little more about that palatine bone, one of the paired facial bones, because it is hard to see from this anterior view. So I'm not even going to bother to point it out just because a lot of times we can't find it on our skull models. But if we flip over our skull and look at the inferior view, we can see this area called the hard palate. And this is formed of two bones, actually. It's part maxilla and part palatine bone. So the maxilla is going to form the anterior portion of our hard palate. If we get specific, this is called the palatine process of the maxilla. And then we have a little suture here, and then we have two processes of the two palatine bones. And in this case, these are called the horizontal plates of the palatine bone. So that is one of the very few perspectives in which we will see the palatine bone. Okay. So those are our facial bones. We're going to look at them from this anterior perspective, but they can also be asked from a lateral perspective. Depending on the bone we're looking at, it might be easier to see from a different view. So just keep that in mind today as you're practicing. Sometimes things like the nasal bones, the lacrimal bones, and then we actually have a little sliver here of the maxilla in between. Sometimes those are easier to identify from this lateral view. So next video, we're going to look at some bony landmarks.